communities, like for all communities, because they are far from the health facilities, and they don't access information and even access the health facilities for services. So when we visit them, that we encounter a lot of issues that's raised by the community. So as we all know, one of the issues is teenage pregnancy. Teenage pregnancy and the increase in number of sexually transmitted infection, which also include HIV. So the increase in the number of HIV, it's it's not that we really do the testing in the clinic. It's always we refer the cases to the hub center, and the HIV is where they are diagnosed and then they are treated accordingly in our hub center. But for other STIs, that's what we are experiencing now, the increase in the number. So for us, when we go for outreach, this is one of our target, to see the, a lot of our communities are there, because I've already said they are so far away from the mainland. When I say the mainland, it's where the health facilities are, the health centers, the hospitals. So in terms of accessing that, they are probably unfortunate because of the geographical layout of the place. So that is something that we found when we visit them. It's STI and which includes HIV, and also now with the Ministry of Health, that's one of the biggest challenge, the increase in the number of HIV. And yes, those are some of the challenges that we see, the problems that we see, the common ones that we see out there in the community. And when we have single mothers, and the other problem that adds on to them getting pregnant is the late booking. Like they come very late to the hospital to be seen, to be booked, and that's something that we're working hard on, to encourage them to come early. As soon as they know that they are pregnant, come early to the hospital, because we all know if they are not seen early, in case something happens to them, then also the baby will also suffer. If the mother is not seen and treated, if there is a problem with them. We work very closely with the Ministry of Health. We visited Nakolinivalu, and that's up the highland in April last year, before the lockdown. And this was an area identified by the Tavua medical area, the increased number of STIs among the young people. And they had a youth training, and the week after we came with a youth officer. And that's something probably that was also highlighted to the Ministry of Youth, that this is the problem up in this area, up in Nakolinivalu. So in Nakolinivalu there's so many villages, I just can't remember the number of villages up there. So when we went, we stayed a week there, and we had to visit all the villages under the Nakolinivalu medical area. Like every day we were going out and coming back in the evening. We provide awareness sessions for women and for men and for young women, and also provide the services. And for us, when we go out there, we bring, because we also have a lab, and we also have the hospital. So we take our specimen there, and as soon as we get the results, we contact them. And like I was happy when we went. We were able to screen women, and then we got some very late cases of cervical cancer. And then we came in, and then we referred them to Lautaka. That was last year, but because doctors in Lautaka were really helpful, so like they were ready to receive them from Nakolinivalu to go directly to Lautaka for treatment. Last month, the total of the services we provide to the women, like there were about 900 plus, 911 to be exact. So that's a number of services that we provide. This is not only to women, to young people, to men, and not only the indigenous and other ethnicity. we have a lab, and they are very active now in advocating for testing for prostate cancer. So the thinking is, if you have, it's very hard for you to pass urine, or you pass urine with bloody urine, and they always say, oh, that's something, the sickness that comes with old age. But now we are trying to tell the men there's no sickness, that's not a sickness of the aged. You need to come. That can be a sign of prostate cancer. So we getting men, a lot of men coming in to be tested for prostate cancer. And we have a lab, because it's a lab, it's a private lab. There is a little fee that you need to pay, reasonable, just to cover the operations of the lab. And to be exact, I think it's $26 for a test. They do the testing today, and they give you the result the very next day. Right? So that's why we had a lot of men coming after we were doing awareness on prostate cancer.